Thank you for coming. And thanks for, as we're settling down, for doing that poll for me. And I'm just having a wee look at the results, and I can see that most all of us, about 8 out of 10 of us, haven't managed to watch that setting the scene talk that I've given earlier. So that helps me clarify that it's my main purpose today is to go back over that ground. And for those that have seen the talk before, an opportunity to reflect on it again and to ask any questions or clarify. And as we go along, people, I'm delighted for you to enter into the chat with me and for us to pick up questions or points you'd like to make. And Karen, I didn't know about the talk. It's okay. Don't worry, folks. If you haven't seen it, you haven't seen it. No problem with that. And today is a foundation meeting to set ourselves on the road to enter after today into what will be a 6-part series. And our theme is about re-emerging. And while the 6 parts of the series after today will very much focus on that, today we'll begin to think about the issue of pain itself, to talk it over, to consider what the issues are with it, and the questions and issues that arise from it. Okay, I think I'm going to just end the poll now. And for those that haven't looked at the results of us here, 56% with a physical pain issue, a smaller percentage, quite small percentage with entirely only emotional pain, but 28% of us with both, 1 in 4 of us with both physical and emotional pain, and only 12% of us not dealing with some form of pain at this time. What I would hope is that those results in themselves might establish the first point for us, which is that pain can be quite isolating, as you know, and it can be a great personal weight that we carry privately often. But I hope you see, even from our gathering today, that we're not alone, that you're not actually isolated in that regard. And in fact, that conditions with pain, the World Health Organization tells us, are the #1 worldwide type of disease and difficulties that bring pain to it. That's how dominant it is. And at least half of us will be dealing with chronic pain, and it's chronic pain principally that we're here to discuss together. Chronic pain in our life, about half of us at some point of the whole population. And someone's just saying how pain frightens me, and it's an important card to put on the table for us. About half to a quarter, somewhere rather between a quarter and a half of GP consultations are pain related. And so as that half of us meets the issue of a chronic pain, of course we tend to go to the healthcare system as so often we should, but you're probably aware now that it's 18 months wait to see a pain specialist, and in some parts of England it's up to 3 years. And like it or lump it, we are often stuck being thrown back onto our own resources. And the focus for today will be very much asking, okay, what resources do we have? And how might we begin to improve my situation? And I've said up to half of us in the population will meet this challenge at some stage. But in fact, at any one point, about 1 in 20 of us is restricted by an issue of pain. which is amazing, isn't it? If you just think of ourselves in the supermarket or the train station or walking the street, just how dominant that is. What a great problem that is. And it immediately tells us that we're dealing with something for which there isn't just a quick fix. Because if there was, that wouldn't be the situation. So that's the clear framing that we are having to deal with. And it impacts, as you know, profoundly on us as a human being. Right across the spectrum, our mood, our energy, our sleep, concentration, memory, our sense of ourself, our world, we can be really quite significantly overwhelmed. And so in beginning our time together, recognizing that we share this predicament, and that how impactful it is, not just in us, because often internally, as we feel this decline and these effects, often we can even feel sense of shame. In fact, for many people inside, or a sense of weakness, and a whole range of other emotions and impacts that can come up from us. I'm just having a look at Karen's comment. Pain specialist, do you mean a back pain clinic? Well, I mean, on average, there are pain clinics which hold pain specialists within them. And that was the waiting time that I was saying. You might be able to see a particular person on a one-off referral to an orthopedic surgeon or a physio. But often what we're doing there, and I want to talk about that a bit, is this distinction between acute pain and chronic pain. Brunetta's saying, I was talking about shame, and Brunetta's offering the word inferior. Yes, weakness, failure. It's very interesting what we do as human beings inside when these things happen to us. And here's the thing, let me say up front to you what I call my news flash number one, right? That as a human being, it's normal. It's completely normal, one, to get stressed, but two, to get unwell in some way. And that includes getting pain and chronic pain, just as it's normal to age and just as it's normal to die, by the way, right? And I promise you're going to die, right? But it turns out you've got at least a 50% chance as a human of ending up with a period of chronic pain. So where's the basis for shame? For weakness, for inferiority? There is no basis apart from the ego's tendency to attack. It loves an enemy, the human ego. And you'll do, by the way, as its enemy, right? It'll either be somebody else or you, or both somebody else and you. But the ego loves an enemy. And so the causes of pain and the distinction between chronic and acute. So chronic pain's defined currently as a pain that's persisted for more than 3 months. So that's what I was saying about the difference between asking to see a physio for your back going out, for example, or some other injury, recovering from surgery, and so on, dental procedures. So when it passes the 3-month threshold, with roughly, these things are never precise, it would be classified as a chronic pain. And why at that point? Because any tissue healing, actual healing from injury or damage or previous infection and so on, by the 3-month stage, the tissue healing has done what it can and is completed. So when we enter the realm of chronic pain, the sensation of pain is no longer saying, help, and my tissues are being damaged and I need to heal them. So this is quite intriguing. Chronic pain does not equal ongoing damage. All right? But logically, we tend to think of it as meaning ongoing damage. And we'll tease that out as we go along. But I'm saying chronic pain does not equal ongoing damage. We're in a different realm by this time, and we're going to have to try to tease it out and understand it. So pain, one of the causes is, of course, that it's secondary to another problem. Pain's not the main issue, there's another problem, and the problem causes pain, such as, I've mentioned, surgery, injury, but equally, and so commonly now in our population, conditions like diabetes, inflammatory arthritis, inflammatory bowel disease, cancer, musculoskeletal problems in the back and the neck, multiple sclerosis, and so on. In other words, there's another disease problem going on, and it is one that tends to cause pain. So that's one big chunk and category of pain. But sometimes there are conditions in which pain is the main problem. For example, fibromyalgia or migraine, or neuralgia, maybe chronic fatigue syndrome with the aches and so on of it, certain allergies. So you see that distinction, that certain conditions happen to have pain, but others, pain's the leading feature presenting with it. And then there is definitely a cluster at times that you see pain in which there is no other diagnosis. There is no other label. The label is chronic pain, which of course is a very frustrating and confusing thing for us to have. What of course it means is not that there isn't a cause, it's that we don't know the cause. So in pain secondary to another condition, such as diabetic neuropathy, the main thing, of course, is you have to try and treat the underlying disease. And so that involves you in medicine and in the treatment there. But if there was a lovely fix to these chronic diseases, well, again, you wouldn't be having any pain. You might not realize it, but the medical model of something goes wrong, you go to the doctor, you get investigated, and you're given a treatment to take away the problem. What percentage of health problems do you think that model fits? The fix-it model. You go along and you've got a problem and you get a treatment and the problem's fixed. I guess, what do you think? What percentage of health predicaments that get taken to the healthcare system is there just a fix? Karen is suggesting 10%. What do you think, people? Is it as low as that? 25%? 2%? We're getting a good spread here. Okay, it's about 5 to 10%. In other words, 95%, 90 to 95% of what we take to the healthcare system, there's no fix-it. Now, the system is fabulous often for the fix-it bit. You know, the broken bone, the acute infection, the bowel obstruction, etc. Thank God for it, right? Incidentally, for those that don't know my background, I'm trained, I'm a conventional doctor, 25 years as a consultant physician in the National Health Service, but I also trained as a GP. And I don't know where we'd be without that wonderful fix-it intervention when it's appropriate. But although I was a hospital doctor, my wake-up call was when I decided to do a year as a GP. Oh my God, right? As I discovered that what was coming in the door, my training wasn't any good, mostly. Right? Because what's happened over the last 50 years, accelerating over the last 20 to 30 years, is this explosion of chronic diseases, which are not infections. And this deterioration in our health, the so-called non-communicable diseases, as now the dominant disorders of health in the population, and they are linked to typically modern ways of living. And so they can't just be fixed with drug and surgery. And yet we've not fully, as a population, woken up to this at all. And the graphs for the figures of these, and we'll look at these next week, are just going up and up. So thus, most people with chronic pain, there isn't a fix. But what about painkillers? It seems quite logical, isn't it? You know, you've got infection, you get an antibiotic and so on. You know, you've got a pain, you get an analgesic. Well, you know, you've discovered the tough discovery that painkillers are not the answer to chronic pain. There's a very stark summary, isn't it? And the discovery of this is a process of disillusionment for us. You know, what do you mean? You know, what do you mean there's no proper treatment? You know, I'm taking these tablets, but I've still got pain. There'll be anger, there'll be fear, there'll be grief, and so on. And then, as Karen's introducing, some painkillers are supposed to be addictive. No, not supposed to be, Karen. They are addictive. That's the problem. Anything that's based around the opiate molecule, and that includes ordinary like codeine and dihydrocodeine, and all the way and then up into the stronger stuff. Not only is it so addictive, but the deaths from opiate addictions are now at epidemic levels in multiple countries. In America, it's I can't remember the most recent figure, but it's over 100,000 deaths per annum related to opiates, and it's become about the 4th or 5th commonest cause of death. And we were sold down the river, and you might want to watch the Netflix documentary on this of the Sackett family, that was sold down the river of pushing fentanyl, a name you might have heard, as being the answer to pain that was non-addictive. It wasn't true, and furthermore, they knew it wasn't true. So not only are they not the answer, but they bring significant problems. And if you've been on these drugs, you'll know that the really difficult situation is at first they work and your pain drops, and then your body adapts to this. And so you have to take the dosage up and the dosage up. Meanwhile, you're getting constipated, you're getting headaches, you're getting exhausted, and so on. And as one of a spectrum, it's not my only field, but I did work in the pain relief clinic of the Royal Infirmary in Glasgow for about a decade. And it was through there that I had to sit with people who'd come to the realization that painkillers were not the answer. And we have to think, what do you do when the toolkits bust? Yeah. And as Vatsala's saying, I don't take any painkillers now. And that's the thing that often my patients discovered, that the truth is, after they had weaned themselves off the painkillers, they were no worse off than when on them. When they're on them, their body had adapted and they were back at baseline. But here's the thing, it's worse than baseline, because I don't know if you realize that opiates work, and there's a bit of a secret inside this. Someone's saying with this, it's just called iPhone, I hope there's some good news coming. You bet your life there is, otherwise this talk should have a health warning, shouldn't it? Yeah, no, there's plenty of good news coming. That the reason the opiate drugs work is they key into receptors, as they're called, like a key in a lock, the receptors in the body for the body's built-in painkillers. You probably know the term now for that. It's called endorphin, which means endogenous morphine, built-in morphine. We have morphine all the time that we make in our own bodies. And if we didn't, we couldn't walk because of the pain. We couldn't sit down. We couldn't function. And when we take the painkillers, the body says, oh, well, so I don't need to make this stuff. And the factory begins to slow down, which means that when you withdraw the painkiller, you're below baseline. Does that make sense? The factory has dropped its own production, and it takes a time, days to weeks, for the body's own production of endorphins to gear back up again. People don't realize they can overdose on paracetamol. Yes, now paracetamol works not through the opiate receptors of the brain. It works in other receptors in an anti-inflammatory way. And so paracetamols are not physiologically, biologically addictive. Okay, they of course, like anything, can be psychologically addictive. But more than 8 a day is an overdose. And it breaks my heart to recall the young people whom I saw dying from paracetamol overdoses. Because what happens is if you're able to get through the acute phase, 2-3 days later, the liver starts to fail. And it's not a way to go. Someone's saying, count myself lucky. I'm unable to take most painkillers, but I can take some paracetamol. Yeah, and non-conventional methods. I want to emphasize again, our whole 6 weeks together will be about the power and transformative change that we can achieve with chronic pain. But I think it's very important that we define our start points and acknowledge and get real about the challenges. Incidentally, of course, if you're taking opiate-related drugs, do not stop them suddenly. Hello, Patrick. Thanks for joining us. Yes, we just discussed paracetamol is fatal in overdose. All right. So if that's the problem laid out a bit briefly, and we're thinking about solutions, and we're saying, well, you can try and treat the primary disease, like the arthritis or the diabetes, that painkillers can be explored, but they're not the answer. Then, of course, it begins to bring us to our pivot point by saying, well, okay, in God's name, then what's the way forward? Okay, now, one of the things that I learned in the pain clinic was to understand and come to rely on the incredible progress and transformations that people can make in chronic pain. And what I'm teaching you and sharing with you is what I learned and was taught by my patients. And that's what's going to be spread out across what's going to be our 7 weeks, a scene setting today, and then our 6-week course. But 2 halves to this non-drug method, non-medical method. And the first I would call just a deepening of your awareness and your understanding about the nature of pain. What is it? What's going on? What's happening in the mind, in the brain? What is it I'm really dealing with? And that then leads us into far more empowered pathways of self-management, self-care, and then re-emergence. So that's what we're going to be tackling, those 2 halves, thinking about the nature of pain and an understanding, and then empowerment into re-emergence. A key point I would like to make, and that's why I put the survey up at the beginning, that I think is intriguing. Physical and emotional pain light up the same parts of the brain. Right? So in particular, there's a very central piece called the thalamus. And when we're in pain, it is activated, be it emotional pain or physical pain. And one of the things where medicine has gone so radically wrong over even the course of a couple of 100 years is the idea that our mind and our body are fundamentally separate. And it's led to real problems because people in physical pain have then been sent to pain clinics, but it hasn't gone very well often, let's say. And then it's proposed to them that maybe some psychological help might be helpful. And naturally, we can feel very hurt, very angry, and very defended. Are you saying, I'm imagining this? Yeah, have you been there maybe a bit? You know, are you saying I'm putting this on? What is it you're saying to me? Fortunately, I never met this problem because I've never envisaged that the mind and the body are separate. For me, it's dealing with the totality of the person. And you begin to see that actually these two things are so intimately linked that, as I'm saying, they meet at some people liken it to a major train station of all the pathways at the terminal into the thing called the thalamus. And so, for example, a broken heart, you know the pain, who doesn't, right? Who's not had their heart broken here, you know, put your hand up, right? The pain of a broken heart is pain. Right? It's not a psychological description, it's pain. And you'll know that you might even feel pain in your chest or aches in your muscles and drops in your energy and so on, as well as that deep central sensation of pain, of heartache. In fact, there's even a thing that people get admitted to A&E through A&E and their ECG, their heart tracing is crazy, right? And they're in chest pain, and you do an ultrasound of the heart and the left ventricle, the main big chamber, part of it is just flapping out of control. And then when you question them about a couple of hours before, typically, they've had an enormous fight, for example, with their partner, or an incredible shock. And the body has been so flooded with these chemicals, it's completely disrupted the body. So when we're dealing with pain, whatever its nature, a loss of inner peace, right, inflames the pain sensation and experience. Does that make sense? So even if the pain you're dealing with was because you were hit with a truck, okay, if you have lost peace in any sense, the pain will be greater. Not because you want it to be, or are imagining it to be, or you're weak, or you're stupid, or you're just not coping. It's physiological. And so I'm going to ask you for our whole journey, in a way, to start to melt the prejudice of a separation from in these departments, and to realize that often the door of entry into calming the thalamus, and let's call it the physical pain, will often be through the consciousness and through the mind. And that is no statement about the nature or the cause of the pain. Does that seem okay? You know, because Karen's saying, yeah, I was told it was all in my mind. God love us. The damage that the healthcare professions do, you know. A holistic approach, said Marie. Yes, holistic approach, Rosemary. One organism, one living creature with a body and a consciousness, blended together. That's what we must work with, and that's where our power lies. Is there such a thing as an imagined pain, by the way? It doesn't exist. There's no such a thing as an imagined pain, right? If you have pain, you have pain. Okay, and then we can think about what's driving the pain and waking up the pain pathways in the body and shifting the chemicals there. But there's no such thing as an imagined pain. Can pain arise from emotional sources? Absolutely. As in heartache. Right? Yes, of course. Can pain arise or be inflamed by deeper psychological? Yeah, sure, of course. Where's the surprise in that? That we're such a complex, beautiful creature as a human being. Yeah, let's turn into the mystery of that, and let's recognize that the pathways into that railway station that we might call the physical pathways and the emotional pathways, that they fundamentally interact. Then, whatever's going on in that complexity, there are factors that can both cause pain in themselves or worsen pain. I'll maybe just list a wee few. Can psychological pain be completely healed? Yes. Yes. And Joe's telling us a combination of meditation and mindfulness. Thank you, Joe, and I will certainly be highlighting that later. Helped, but I had to find them myself. Yeah. Join the club, Joe, I believe my daughter's pain is a lack of peace through trauma and various past events. Yeah. And what about the pain of an amputated leg? Well, we know that the neurological input to the brain can be disturbed. You all know that. And you know that there's incredible studies. People have had phantom limb pain, as it's called, and you put a split mirror down until it tricks the brain into thinking the missing limb is present, and the brain begins to drop the pain. Right, so there's a lot of creative room for movement, but whatever the cause of the pain, including an amputation, I'm saying one of the doors into helping it calm can often be through the mind and emotional factors, even though the cause is a straightforward damage to the nerves. Thanks for these chats, people. Someone's saying my subconscious looks for pain on waking. Yeah, keeps me anxious from the start of the day. Isn't the mind wonderful? You don't have to go on a course to learn to think, do you? And I've noticed there are no Goldster classes on how to become anxious. Yeah, how to get angry, how to get afraid. We don't wake up in the morning and make a decision as to whether we're going to think or not. Off it goes. Off it goes. And we'll talk about the mechanisms that causes it to scan for pain on the second that we awaken. Sorry about that. So factors, I was saying, that weights on the seesaw that can inflame things. Disturbed sleep. Definitely. All sorts of complex levels. Being deprived of sleep or having disturbed sleep can inflame pain, and you can imagine the chemical upsets and lack of opportunity to resettle the brain and the brain chemistry there. But intriguingly, in and of itself, it can begin to cause pain. Mood disturbances will influence pain as cause and effect, and as worsening. So, depression, anxiety, and so on. As someone was saying, post-traumatic stress disorders can cause the brain to lock on to what's called hypervigilance, looking for the threat. This is very common in us as human beings. How can we see comments from the group? Sorry, I think you hit the wee chat, the chat icon at least on my one, it's third from the left on the screen.
It's not open, David. It's only directly to you.
Sorry. The
chat's only.
Is it? Well, you can put chat to everyone. See down at the bottom of your chat. At the moment, it's saying to Joe, at least on my screen, if you put the drop down arrow there, is there not a for everyone?
No, it's not been opened. It's only on David Reilly host.
Try that now.
No, it's not open.
Forgive me. That was it's not in my domain there. That was Joe, who's set us up for us. I'll keep reading out these chats if that's okay then with you. Actually, it might help you more focus anyway. there's a silver lining in
It's
everything.
the little triangle to the side of the chat. Usually you can change the chat preferences, or on the participants you can say allow access.
Yeah. And is that available to me if I look on the participants?
Yeah,
Hang on then.
if you're the
Yes.
host, you should be able to go to
It's only you.
I'm the host.
Yeah.
Isn't that good? More maybe, under more.
Either under participants or under chat itself.
No, I can't see it. So forgive me, I'm not going to divert more at the moment for that. I was talking about PTSD as a direct cause of pain and as a worsening factor in pain. And one of you is telling me that following emergency admission to hospital, I was traumatized and I'm now super vigilant looking for pain. Exactly. Adverse childhood experiences set the nervous system into a certain mode that can be stuck on and carried into childhood. You've maybe heard of a wee thing in the brain. And by the way, everything that I think I'm sketching on today about these ideas, we will revisit them over the 6 weeks. Okay, and expand on them. So, but to give you the heading of an adverse childhood experience at the moment, it sets a part of the brain you might have heard of called the amygdala. It looks about the size of an almond. There's 2 of them, one either side, and its job is to scan for threat. And those of us that have had adverse childhood experiences, which includes lack of love, abandonment, abuse, being around violence, being around alcoholism, these sort of things, often enter into our adult life with the nervous system changed around this. Straightforward fatigue will worsen our pain, and also a deep level that we'll have fun exploring later, what I'll just call mistaken beliefs. For example, the amygdala believing that you're living under continuous threat. I would call that a mistaken belief, and that will often inflame this situation. Okay, so if I've sketched a wee bit there about some of this powerful interaction between the physical and the emotional and some of the aggravating factors, what happens now is, of course, you begin to enter, let's call it the medical journey. We've had some remarks on this already. Polio age 4 is affecting me now with muscle weakness. Yes, Lyndon, that's a direct physical change in the body, isn't it? But it wouldn't necessarily, it might and it might not, have led to that increase in what I call the amygdala's vigilance. And it wouldn't be surprising if it did in any of us. I'm not being personal. Of course, I don't know your circumstances. So we go into the medical journey because when we've got chronic pain, often our first question is, isn't it, well, what's wrong? We want to know what's wrong and we want a fix. So off we go into the journey. And the medical journey is often quite helpful at ruling out concerning stuff that needs direct treatment. For example, a cancer being present, or a vicious inflammatory process. But so often that's not what the issue is about. And so the doctor comes back to tell you, well, I'm pleased to tell you, the tests are clear. Emma, I think it's Emma, I'm just going to mute you if I can. Thank you. For now, so what happens when you've got chronic pain and you're not doing well and your life's changed and you're restricted and the doctors tell you, well, pleased to tell you, the results are clear. What happens then? What does a normal human being think and feel? Frustration, saying Rosemary, absolutely. Oh, yeah, panic, anger, yeah. Rosemary, you've said defaulted, not sure, deflated. Yes, thank you. I don't know if you're a bit dyslexic like me, you know. As we're putting those remarks, someone was saying earlier that COVID, they were terrified, and CT scan results looked like a possible cancer diagnosis. And I've never felt the same since. Like I left my true self in hospital. Fear. So we're talking about, yeah, look, that's great, says the doctor, please. These results are clear. I'm pleased to tell you. And you think, oh, shit, right? You know, what are you saying? You're saying you don't know what's wrong with me. Have you missed something? What do you think that does to the amygdala? Right? Can you see that? That sometimes it's actually switched on from the medical intervention, and the person said, the doctor says, and I'm sorry, nothing more can be done for you. Have you heard that phrase? It's not true, right? But I spoke of mistaken beliefs. See, now, if a belief settles itself in the mind, oh my God, they've missed something. Okay, there's one that can set the situation on fire, and another is nothing can be done for me. Right, I'm on the scrap heap. Right? But actually, if I can be kind to the doctor or whoever it was, what they meant to say was, there's no medical fix for your problem. That's not the same as nothing can be done. Right? Because there's two great avenues. There's the outside in, fix it. And yes, we go to check it out and get tests, and the doctor says, no, that's not applicable here. But the other big avenue, the other big river that meets and blends is every day, all the time, the body is working to restore itself, to heal, to recover, to rebuild. And I came to spend at least the last 2/3 of my career studying this capacity in human beings. And it's enormously powerful. And something can always be done for that person to enhance again their quality of life and their well-being, and often to reduce the pain. But we can hear it as a life sentence, and then we see it as an abyss or an enemy. And this in turn, of course, at that railway terminal I described in the thalamus, is further inflaming the whole situation. And we're now into a spiral, and we're stuck. Yeah, you recognize this? I can see heads nodding for me. Yeah, feeling alone as if I have to deal with it myself. Yeah, maybe they've missed something. And then someone's asking me, could I get over childhood pain despite numerous therapies? I couldn't go over it until I started writing my memoir, and found that healed me and turned me into a happier person. Was I cured by the act of writing? No, you were healed, not cured. Different thing, right? Curing's coming in there with a medical fix-it. Healing is tapping in to nature's own capacity, nature's own healing. Yeah. Someone's saying, I'm in this place, this abyss, this black hole, help. Yes, yes. And it's my job to tell you help is available. Okay, in fact, I have a criteria that I refuse to see anyone in the pain relief clinic, and I refuse to see anyone admitted to this course if their heart is not beating. Okay, that's my absolute admission criteria. And I look clinically, as I'm looking now at the camera, for that clinical sign. And see if the heart's beating, you're in. Okay, you're in. And the journey begins, and we're off. I had to come, Rosemary saying, to a place of being more than my pain. Yes, Rosemary, absolutely. So we're getting honest about how common chronic pain is, how it's rising in modern life, how the truth is, typically, most of the time, there's no great fix at all. How, in fact, some of the fixes are adverse. And then we've looked at the fact that physical and emotional pain fire up the same pathways of the body and the pain centers in the body. And that's deep necessary knowledge for us. And then we've acknowledged that certain factors can be really setting fire to the situation, like mood, stress, worry, fear, fatigue, past trauma, and so on. And then we've come to have to recognize that the medical process is often itself traumatizing and further inflames the situation and can even insert further troubles in us. Okay, let me illustrate that maybe a wee bit with a patient of mine that I'll call Mary. Mary was in her 60s, and Mary had, let's call it, good old proper physical disease, you know. She had great autoimmunity, systemic lupus erythematosus. She had inflammation of multiple nerves, neuropathy in her feet that caused it with such severe pain that she had more or less stopped going out, but when she went out, sometimes the pain was so severe she had to drop to her knees in the street, and she pretended to have dropped her handbag and was, you know, picking things up from it. She was seeing, I think, 9 medical specialists when I saw her. She also had other physical diagnoses and problems. And I see her after the pain relief clinic. That was the deal between me and my colleagues. I'd see the person if the clinic had failed. So my specialty, which might apply to you, is what in medicine was called hopeless cases, right? So Mary and I sit down together and I give her the time, an hour, and I'm hoping this course will give you the time, you know, to come to a deeper dialogue and understanding and lay it out together. And then I hear a story from Mary, and it's that she had a mole on her back that seemed to maybe change a bit. So what do you think happened immediately inside Mary's mind at that point? Yep. So a fire's lit, of course. Who isn't it? So she goes to the GP who says, let's get this looked at. The fire's getting worse. Right? Then she has to wait weeks. It's now getting a bit out of control. She sees the doctor who says, okay, let's biopsy it. Now she has to wait for the results. How's she doing now? Not so good, right? And then she sees the doctor who says, thank you, I've got the results of your investigation, and I'm pleased to tell you that it was completely normal. And Mary said, Doctor, see, in view of the fact that you thought it was worthwhile biopsying that, do you think I'm at increased risk of cancer? And she said, and this was her words, the doctor drew herself up to her full height, note, and said, I can't answer that question and no one else can. How do you think the amygdala interpreted that? Can you see what it would do? It's going to lock on. So I talked this over with Mary and I helped defuse it. And then off she goes. And I could only see people about every 3 months because of the waiting list and all that stuff. And she comes back in 3 months later and she tells me that her pain that was at 9 to 10 out of 10 is now about 1 out of 10, that she's out and about, that she's doing great, that her chronic anxiety has settled, and that her life is transformed, right? And I said, you know, and she thanked me for doing this. I said, Mary, I didn't do this. What do you mean? She said, you know, I said, you took this on board and you worked it and your mind was able to be brought back to peace. And she said, oh my God, you're right, doctor. There was this brick wall that I was dealing with of fear and worry. And our talk together helped bring that wall down. And she became effectively, as a person with minimal to no chronic pain, despite the inflammation in her nerves. What do you think Mary's teaching us there? Teaching you? What's she telling us, do you think? Because this is about learning. This is about becoming a student again, thinking in fresh ways. One of you saying the mind is in control. Yes, the mind was in control, right? And now it isn't. But it didn't defuse itself. And I'd like to do that as an introduction to the fact that we're more than our mind. State of mind. But Sarah's saying, yes, it's a good phrase, state of mind. But I'm going to use this for you, it may be an odd phrase. We have a mind, that's for sure. But we are more than our minds. I'm just going to leave that to percolate for a while, right? Our fears are the worst enemy. Yes. Earlier, one of you was saying, oh my God, my fires are ignited all day long. Yeah, the fire of the mind. Someone's asked me about Dr. Terry Wales' approach to recovery. I don't know that about that. I'm sorry. So the amygdala's job is not to make you happy, by the way. It's to try and keep you safe. All right? And it's designed to try and spot threats. And it typically interprets a pain signal as a threat. Something's wrong here, it's saying. It treats it like a fire alarm is on. And it leads to what would be called hypervigilance, increased vigilance. Let me illustrate a tiny wee bit as we step into the mind. I'd like you to become aware for a moment of your right foot. Okay? In fact, ask a silly question. Is it still there? By the way, if the person that had an amputation was your right foot, could you use your left? Which would probably be easier, right? Is my right foot still there? Just do that for a moment. And pick up the feelings. You'll be able to begin to notice where it is in space. Feel the sensation of the shoe or the clothes against it. Can you do that? Okay. Something, and we'll name it later, just took charge of the mind and instructed it as to what it should tune itself to. All right? Now, see those sensations in your right foot? Where were they before I asked you to feel them? Interesting puzzle, isn't it? Because that helps us build a vocabulary for ourselves. Rebecca's saying we'd gotten used to them. It's not even that, we weren't even aware of them. Is there a similarity between the function of the amygdala and ego? Yes, they very much dance together. The amygdala feeds information to the ego, and the ego sets the thermostat in the amygdala. Someone's saying, and that sensation in the right foot was out with our consciousness. Yes. So body sensation can be within consciousness or out with it, below it, as your right foot was until I mention it again now, and now you're beginning to feel it again, right? As the sensation is brought in and out of consciousness, according to what? Attention, where attention is placed. What I'm trying to illustrate for you is when the amygdala thinks there's a problem, what I called hypervigilance is it's monitoring it. It locks on and monitors it, even in our sleep. Can you see, even though you might not know how, can you see any hint of a useful secret in what I've just illustrated for you? Yes, says one of you. I did a chronic pain course where we were told to put attention on the pain. Yes, and I'm going to come to that later. It's very curious. But the key there was, Rebecca, you took charge of attention, right? As opposed to when you let go of being in charge, which is, of course, natural, there's something called the default network in the brain. And again, maybe in part 2 of our series, I'll return to that and I'll show you a picture of it. But the mind will work just fine without you, by the way, as you've noticed. Okay? You can even go right through your whole day and go to bed, and there was nobody home, right? It was being run by your mind. Just like, say, if you've been on a journey from A to B, maybe you were driving, maybe you weren't, but you don't remember any of it, right? The mind was doing that for you. So yes, the mind, when it goes into default mode to run your life, if it's locked on through fear, worry, resentment, bitterness, hatred, past trauma, lack of feeling of safety, lack of clarity, and if it feels if there's something going wrong in me that might damage me. Do you see what I'm saying? What can bring up to the surface real sensations. There's no such thing as a not real sensation. You did feel your right foot and you weren't until I've mentioned it to you again, right? You see what's happening? But if the mind is mentioning the pain all the time, 24 hours a day, subconsciously, whoa, then the apparatus, the machinery is locked on. And that's not psychological, right? That's physiological, that's biological. And Rosemary's saying, so if I put more attention in my pain, I become more aware. Yes, if that attention is driven by the amygdala and its fear and its worry and its stories. Yes, that's true. But as was earlier mentioned, and we'll talk about it by Rebecca, if we consciously sit down with the pain in ways that I'll mention later, we're actually in charge at that point. That's not the brain locking onto the pain, that's our consciousness. This is what I mean by we have a mind, but we're more than our mind. One of you is saying, and forgive me, I'm not using the name, but for some of you, it's just identified as like iPhone or iPad. I'm definitely locked on. Where's the release pedal? What a fantastic question. It's questions that will set us free, right? Because what we're doing, it's like opening a blank page into inquiry, into learning, into wonder, into adventure. And that's what can bring forward fresh creativity and insight and learning. Questions are wonderful. So yeah, where's the release pedal? That could be the subtitle of our course, by the way. I like it. Okay. Could you ask Goldstein, I'll take that as Goldster, on our behalf, to include your classes on the daily emails we receive? You'd be better asking Emma. Yeah. Right, where the hell was I? So, I'd like to move to a concept as a start point. First of all, I want to introduce the word, I've introduced the word awareness, what's going on here. And we've got some hints of that, structures for that. And I think, Rosemary, you're acting a bit psychically today because you've picked up the next word I was going to be using, I think, or coming to. The next word, if the first day is awareness, the second day is acceptance. Now, acceptance is a really quite profound and powerful concept. What do I mean by acceptance? What are you saying, doctor? I should just accept that I'm in chronic pain and this is the situation and so on. Let's be clear. I'm not talking about resignation. Resignation is sitting on your ass and giving up. Okay? No. Acceptance is a very powerful concept. For example, imagine you went out and it's raining and you decide to not accept that it's raining. How's that going to go? Yeah? It's not going to go so well, is it? You could call it fighting with the rain. And the mind does fight. And it even says things like, it shouldn't be raining. And it's not fair that it's raining. And the rain is ruining my day. And then it'll build more elaborate stories like, that's always what happens to me. Life stinks, or it's my fault, or I'm a failure. This is called fighting with reality. Okay. Acceptance is the exact opposite of that. And a wee phrase that I would recommend and offer you is, so this is the way of it. This is the way of it. At this moment. That's all. Not some movie about the past and about the future. Those are imaginary worlds, the past and the future, constructed by mind. No, just now. Okay, so this is the way of it. And this can be incredibly empowering, because then we can say, okay, given that it's raining, given that my health isn't right, or whatever, fill in the blank for yourself. Given that it's raining, how shall I approach it? So a whole host of energy that was being drained away and being at warfare is suddenly made available. And we've already taken a step forward. And to pick up that word that Rosemary introduced, I want to introduce the idea of your relationship with the weather, right? With the pain, with the rain. Brenetta's saying she needs to go, but yeah, catch up, Brenetta, so that you're up to speed when we meet up for, quote, part 1 next week of the 6-part series. Are the rest of you okay that we keep going on? Okay, good. Let me tell you a story about Gordon. I don't make up stories, by the way. These are real situations. And Mary I've mentioned and Gordon I've mentioned. I'm quoting from recorded consultations that I use in teaching, because I teach about how to create a therapeutic meeting between people. And so Gordon's very in my mind because I've watched the video many times. Gordon had TB as a child. His spine was uncurved. Many discs were crushed. Many nerves were being pressed on by discs. The pain was streaming down into his right leg. You can imagine how disruptive of his life this was and how much pain he was in. He couldn't, apart on a very good day, he couldn't go up the stairs. He was restricted. He could only walk for a few yards, and so on. And his ability to be a dad and to be a husband and enjoy his life was completely disrupted. The painkillers weren't working. Injections hadn't worked. He had seen rheumatologists. He'd been to the pain clinic. He'd seen psychologists. He'd worked a lot with physios and more. Okay, so we sit there and we hear the story of the rain, and we take that and we accept that that's where we're at, right? And at the right moment, I asked Gordon, how do you feel about your leg? And I'll continue, if you don't mind, to use Glasgow vernacular. It's not meaning to offend anyone, but, sometimes it's the real thing. He said, I fucking hate it. He said, I'd cut it off. It's destroying my life. And as I tell you this story, I'm asking you to think about your relationship to the disruptions of your well-being, mentally, physically. Yeah? And I said, okay. And then there's a thing in Zen called the sound of one hand clapping. You're familiar with that? Bringing the mind to the halt a wee bit so that the chattering mind is shut up for a moment, and there can be a wee bit of, fresh reflection, fresh perception. So I just asked him, Gordon, how do you think your leg feels about that? And he just came to a halt, right? I said, if it had a voice, I wonder what it would say. you know? And I'm asking you this about the part of you that's in pain, right? And what came out was an understanding that this part was suffering and was in pain, but it was doing it on Gordon's behalf. It was trying to keep him going. It was struggling to stay mobile. It was struggling to deal with the situation. I'm putting to you a basis of, let's call it even something called friendship. Now, that might sound really bizarre to you. I'm not asking you to become friends with the sensation of pain. I'm asking you to consider a friendship with the part which is in pain, the part which is experiencing pain, and to let's call it stop the war, right? And even go into partnership together. How, I wonder, would you view that prospect? And if it could be achieved, what would you intuit would be the outcome of it? I'm talking about entering a respectful relationship that's nurturing to the part that's in pain. I'm talking about compassion. And as Joe said just a moment ago, compassionate acceptance. I'm getting a couple of thumbs up from my Glaswegian. Thank you for that. Is it the same concept as loving yourself? Well, Rebecca, I'm going to be a bit circumspect about the use of the word yourself. And we'll go into that and I'll really clarify that through the course. Because sometimes this self is the egoic self with all its story and all its attitudes and etc., right? In general, I'm going to use throughout our course of an opening of compassion to life, spelt with a capital L. And I'm going to define life as the thing that beats your heart, not your life situation, your life. And yes, loving your life, I think's far more successful than loving yourself, which, by the way, I wouldn't bother trying because it's very complicated, you know, a relationship with the self. Love your life and thank your body and your mind and emotional body for doing its best for you every day, day in, day out, as it is experiencing the pain for you. What might happen, and Gordon was one of my teachers, I see him 3 months later, and it's another story worthy of nothing less than the word transformation. Absolute transformation, with a collapse in the pain level and its intensity, and a restoration of feelings of well-being and a better life, a better life. The pain could come up and down a bit. He said, but when it do, he said, I just speak nicely to my leg, he said, and we get on with it as best we can. Another interesting thing he taught me, which is a wee bit of an aside, is that healing can begin subconsciously, just as lack of well-being can begin subconsciously. And he said to me, the funny thing he said was, I was getting better and things were going better, but I didn't realize it. Which is interesting, eh? And it took about 3 months for it to surface consciously, about 2 months rather. Rebecca's saying by yourself I meant your body. Well, it's certainly part of the self. Yep. But what keeps the body alive? Aha. Okay. And being seen, acknowledged and listened to can be transformative, not judgment. Yes, Rosemary, curiosity in a field of compassion. Yes, definitely. These things are healing. And so I helped set up the conditions for Gordon, for him to have, let's call it a reconciling and loving dialogue with the pain, with the part that was in pain. And I will do my best to help you with that as I'm doing today, but principally, you're in charge. Okay, and it's my job to try and give you some compass settings. Let me just have a wee look at this next one from Sue. I recently had a sudden unexplained realization I shouldn't be so frightened by my knee pain, and that if I kept moving, nothing worse would happen. Yeah. Does that wee story to everyone now be a wee bit clearer than before we started? Can you envisage in the brain scan the shift that's happened in the amygdala there? And therefore in the cascade of pain inflammatory molecules and the beginning of the production inside of the endorphin molecules? Kindness is powerful. Do you know, I think kindness might be the most powerful force on the planet, actually. Yeah. Joe, we're hard on ourselves. Yeah. No one harder. You know, sometimes they hurt us once or a few times. You know, they abandoned us once or whatever it was. But we've relived it every day. Repeating the blows and repeating the blows. Yes, definitely. Very hard on ourselves. So, becoming free of fear, and thank you for that story about the knee, as Gordon did and as Mary did, leads to a fundamental shift in perception. And I don't mean psychological perception. I mean in the apparatus of the brain, the perceptual apparatus of the brain. Let's look at that as a wee exercise, a wee imaginative exercise for a moment to bring together some of what we've been chatting about. I'd like you to imagine, hi Rebecca, I'd like you to imagine that you're on holiday. You've been on this holiday before, Rebecca and Emma, because I've been at my teaching before, but why not go on it again, right? So you're on safari, people, and you're having a fantastic time. What a day, you know? And you're going through the long grass and looking out for the big five, and maybe there's an elephant over there, and suddenly you stand in a snake. Have a reaction, please, and monitor it and notice what happens. You got it? You something happening? Can you feel it in your body? Feel it, really feel it. And can you feel it in your mental state? Right? And instant fear, as someone's saying. Good, you got it. Panic, nothing less. Heart in the mouth, yeah. Various other bowel and bladder disorders may occur, or you might even pass out, right? Okay, paralyzed is another possible reaction, isn't it? Goosebumps, yep, which is fairly cool actually as a reaction. I'm going to die. Good. So we've got it, right? So you stagger back, and in a moment, Rebecca's saying she wants to apologize to the snake, but then Rebecca's on a higher plane than the rest of us. Have some compassion on us, Rebecca. We're in panic at the moment. Right. Anyway, so we stagger back, and it's only then we notice it was a rope. Now monitor what happens. Really feel it, because it's quick and it'll move. See if you can tune in to the shift and notice what shifts and how quickly. What's happening in your body, what's happening in your mind. Relief, relief. Thanks, Karen, who's pointing out that the word COVID could produce the same reaction. Absolutely. Relief of fear, nervous system relaxing. Yeah, the beginning of calmness. Good, good. So what caused your fear? What caused the fear? What caused it? Wasn't the unknown? Wasn't irrationality? I'm being harder on you, Rebecca, because you're an advanced student, right? Expectation, we're getting there. Interpretation, the story of the snake. Yes, right? Maybe one word we can use is perception. So the amygdala scans the environment and makes a decision, by the way, about 125th of a second before you're consciously aware of the decision it's made on your behalf. See, you think you got frightened. No, you didn't. Okay? The amygdala made you frightened. Why? Because it believed it was a snake. Perception. And it was automatic. Did you decide to get anxious? This fight or flight response, as a couple of you quite rightly saying, and putting in imagination and past experience. Yes, the amygdala takes its scan and it immediately feeds it through something called the hypothalamus, and it forgive me, it's the hippocampus. Feeds it through the hippocampus where the memories are stored to say, is this something I should be worried about? Okay, and if it's learned that snakes are bad, and by the way, it probably didn't need to learn that because it's probably biologically programmed. All right, or I've had a bad experience in the past, then the answer is reinforced to the amygdala, yes. And boom, the explosion is set off. Of course you didn't decide to get anxious. Who does? Of course you didn't decide to get depressed. Of course you didn't decide to do anything that would inflame your pain or increase it. No. This is what I'm meaning. You have a mind, but you're not your mind. And remember I said that we had two halves, and the first was deepening our understanding of pain and the mechanisms. And then the second half is empowered by the knowledge, setting off into the course of re-emergence. So this is very important information. Very important information. And if you're living in any way with a loss of peace, okay, something of this nature is going on in your being. Whoa. And isn't that most of us most of the time? Let's be honest. So this is critical energy, information. You happen to be calling it pain, but please let me tell you that suffering and distress is ubiquitous. And it may take the form of pain, but it may take many other forms. And that what we are discussing at the moment is universal ground, relevant to human distress and suffering and pain. Yeah, horror films like Snakes on a Plane or Arachnophobia have a lot to answer for, Rebecca. Yeah, but here's the thing, Rebecca. Why do they work? They work because the mind is primed for these things. This stuff Kay's saying is definitely happening for me. So we have a snake state and a rope state. And beyond that, by the way, we've got getting back on holiday state. Okay, but even for now, let's settle for getting to the rope state. And in the snake state, the pain, all pain, can only be further inflamed. That's just the way of it. So this is what I meant about making peace with the pain, the part and pain, and making peace with the rain. So that now we're coming into a relationship that's not built on and being inflamed by pain, by fear, by the snake state. Someone's saying a sneak state is one that sneaks up on us. It's Rebecca again. Okay. And perception is key. Where the mind leads, the body follows. There's one of our aphorisms that we'll look at in parts 1 and 2 of our course. How long does it take to change the state? Well, how long did it take you to react, to realize from the snake to the rope state? It can be quick. Is it quick most of the time? No. All right. But what I'm wanting to offer you is a North Star setting. I'm wanting you to see the power of, let's call it, a perceptual shift, and how that can either be suddenly quite powerfully helpful, or it can seed a change process over time. Remember Gordon's statement? Things were starting to go well, but I didn't even realize it. And certainly what you don't want to do to a system that's been under strain is, begin to threaten it, because that's how it would perceive it, as I want a quick change out of you. Can you see how that would become another snake? It's putting a gun to its head. I want rid of this pain. I need to be more mobile by 4 months from now so that I can go to my holiday or whatever it is, right? It actually will be perceived as a snake. Such a statement. What works is a loving, nurturing relationship. Okay. So it can be almost instant, but will it be permanent? No, it doesn't follow. Often recoveries like this, right? And why we'll be up against, I'm going to call them maps of the mind that have been built there over years and even biologically over great eras. So no, this is a journey of change. If you're blessed with some quick change, good. And if you're not, good. It's all right. Okay? Let's not get into performance anxiety here. All right? But no need to resist. If suddenly you think, something, yeah, maybe I have been viewing this thing like an enemy. Yeah, maybe I have been walking around thinking it's a snake. And you say to it, come here, sweetheart. Come here. And the war begins to stop. Yeah, we can see some lightness often quite quickly entering dark situations. And Emma's using a key word, and Emma's been working this material, I know. I've been training my mind successfully to view problems as a challenge, and that's empowering me to perceive possible solutions that might come my way. Yes, key words there, Emma, training. Your poor, sweet mind that may have been living in a snake pit, may need a great deal of patience and tolerance and education over time. So we've talked about some of the roadblocks in terms of the perception. We're talking about shifting the relationship with acceptance, as I've defined it, and particularly shifting the underlying spirit of the relationship between you and your life and any breakdown in your well-being or health. And now let's think a wee bit about the third A. So I've been using as a wee memory hook 3 A's. Awareness, as we've been exploring a number of ways. Acceptance, well, it's the relationship and so on, and the rain and the weather. And then action. But action needs to flow from the first 2 A's. Not just shooting off out of our head and its ideas. And as we've said earlier, we now see that action is going to have to involve soothing. It's going to have to involve healing instead of curing. And it's going to have to take on board the wholeness of ourselves. And so let's talk about the approach to action. And I'd like to... How are we doing energy-wise? Be all right to do a bit more? Okay. You're doing good, by the way. Yeah. Right. As we move into action, I'd like to be clear about 2 different areas that dance and interact together, but it's worth separating them. The difference between pain and suffering. Big difference. All right, and very helpful to ponder on the difference. Pain is a sensation that hurts. By the way, that's as good as the academic literature has managed to find to date in the definition of what pain is, right? But it is a sensation. So in other words, it's something about the right foot, it's something about a signal that feels uncomfortable or is hurting. Pain is a sensation that hurts. Okay. Now, pain can only be experienced when you're conscious. It might be there, but you are unaware of it, your right foot sensation, right? Pain is experienced as a sensation in consciousness, and it can only be experienced now. Right? Does that make sense? You can't experience the pain in the past or the future. You may have a memory that they did and an imagination that you might, but that you're not experiencing it. You can only experience the pain now, and that includes when you recall the past. It's not past pain. It can only be pain right now that you have. A sensation that hurts, that occurs now, that is very, very modified by the nervous system's level of attention to it. I think that should be clear to you now from our wee shorthand of the right foot. Okay. And that's different from suffering. Okay. Suffering is a state, and we've talked about this, the snake state, haven't we? Suffering is a reaction to the pain. And it's a very complicated, rich thing, suffering. It's raining. Okay, there is sensation, there's water falling on the head, all right? And then there's how we are with the rain. Does that make sense? Yep. For example, anguish, fear, anger, rage, despair, depression. And suffering is especially often, it brings in the imagination and the storytelling ability as well of the mind, because the mind is given to catastrophizing and seeing a terrible future and interpreting the meaning of us being in pain. It sees it and tells a story that we are broken, our life is broken, etc. Now, the pain sensation can sometimes be helped, okay? And we'll talk a wee bit about that in various approaches. And it can certainly be getting modified by practices about that threshold of above and below consciousness. Okay? Yes. But with the best will in the world, you're not going to be 21 again, people. Okay? And my hair's not going to go back to being black. Right? And you might be left with some pain. We have to be realistic, right? So pain can be helped and modified and so on, but you might be being left with some pain. I don't know. You don't know, right? But I can tell you that suffering can always be helped. Always. Suffering is always up for change. And that the dominant problem in chronic pain is suffering. And just imagine who you'd be, that you still have your pain, but you're free of all suffering, free of emotional distress, free of worry about it, free of stories that you tell about how it's not fair that you've got it and so on, and what it's going to do to your future life. And see if you can just sense having a go at that. It's the extra layer we add to the pain. It's nicely put, Joe. And I'd modify it slightly to say it's the extra layer that the mind adds to the pain. You didn't decide to add it any more than you decided to get nervous about the rope in the ground. And that's quite important. We need to get beyond this idea that if people would just sort their attitudes and change this and that, you know, they could all... No, we're up against biological machinery here. Okay. And it will take, and we've heard hints of that, various forms of training and insight and shifts of perception and journey into that becoming free of suffering and re-emerging. Is the reaction classed as instinct? Yes, it's absolutely founded on instinct and the design of mind. But those instincts can be reinforced by early training, early trauma, difficult situations, and then habit formation by the brain. Not by you, I'm not making any personal comments, but the brain can become entrained and stuck in ruts in ways of perceiving, ways of reacting, or with training over time, that which is instinctive can begin to be calmed. And what's really being calmed isn't the instinctive potential so much as, say, the amygdala that triggers it and opens the gate and lets it bolt. And there's research, I'll show you in our course, that mindfulness and meditative training modifies the brain itself until the brain begins to calm and stop seeing snakes everywhere. So, in tackling our action points, a big area, beautiful, rich area, is this one that we've been talking about that inner self, about the human spirit, about the mental body and consciousness, and training the mind, helping it understand that its viewpoint is up for question, right? But literally, it's up for question, and training it back into calmness and warm-heartedness, back into gratitude, back into things that really calm the amygdala. And we'll look at inner strengths of our deeper self. These are very, very powerful in countering instinctive reaction. Things like, you know, courage and commitment and loving kindness and hopefulness are very powerful in this situation. Meanwhile, you're doing whatever you can in supporting your body if it's dealing with physical pain. You know, movement, exercise, stretches, someone was saying earlier, yoga, the Tai Chi, all the lovely things on the Goldster platform, thinking an infrared lamp or topical creams or acupuncture, massage, you know, good. But please don't go looking for them as a cure, right? It will lead you into confused and disillusioned places. They're just forms of support, is the way to view it, I think. Right? Otherwise, you'll just go up in your hope and down in your dashed expectations, and it just inflames the situation. The way that we eat, and I'll touch a bit on this next week, can modify the chemicals in the brain and the tissues and the inflammation that's going on. So yes, we do want to think of the physical needs in the body and its support as we get down to the deeper work of inner process. And what a combination, right? Can you see that? What a combination. And God help the doctor that told you nothing can be done, right? Because they're living in a narrow world. And I'm not being critical, just like you and I live in narrow worlds, seeing snakes and living in our wee universes and following its rules. And all of us, for about 300 years actually, building from the industrial and scientific revolution, have had a growing map then it will be an outside expert that will come along and do something and fix us. We're a fish that doesn't know it's in water, right? And we are as in it as the medics are in it. And we've been talking here about coming off that map and looking at the adventure and possibility. And then a last thing I want to touch on that was just mentioned earlier was the paradox of turning towards the pain. Now, see, the amygdala is constantly saying, what is this? What is this? What's going on? Right? And it's an odd thing that you can use, sometimes it's just as first aid or a bit of support. I'm not necessarily saying it would be a healing in and of itself in a quick way, but there's a wee technique called the artist's stool. And what you do is you sit down and you get yourself in the right frame of mind and calm yourself, right? And then you turn towards the pain. Part of this isn't there that I'm adding in for you is to say hello to it, you know, and take a nice, calm and caring approach. But then you start to try and visualize the pain, like an artist who's studying a scene that you're going to paint. You know, you get your wee stool out, you sit down, you've got your easel there, and you're beginning to study it with a curiosity, a soft curiosity. Where is it? Right? What shape is it? Does it seem to have a center? Where does it spread to? And then you really use artistic imagination and you decide maybe, what's it made of? Now, don't be rational here. We're being imaginative. Is it a cloud? Is it a piece of blue glass that's stuck into your leg? Is it cork, wood, metal? You know, does it have a temperature in your imagination? You read it out and you touch it. Does it have a sound if you tap it? What colour is it? See what I'm saying? So you're actually taking quite a long time. And what you'll often discover is the amygdala is a child, by the way, right? And it's been desperately asking, what is this? What is this? Is it a snake? Is it a snake? And suddenly it's being presented with an answer. This is my best explanation for the phenomenon that says, oh no, it's just a cloud, a blue cloud with, you know, moving like water. Oh, that's what it is, says the amygdala. And you know what sometimes happens? The pain drops. And then what you do is you keep going into it. And it morphs and changes shape and you go with it. What colour is it now? What shape is it now? What's it made of? What does it feel like? And so on. And you just sit with it. And you'll be, perhaps, if this suits you, but you may be amazed to discover that the sensation starts to diminish. So that's the first thing called I'll call the artist's stool. The second might be called something like the eye of the storm. This is one thing that I found with my own patients. I haven't seen it elsewhere. All you do, you sit down with the pain and you turn towards it, right? Eyes closed, if it's helpful, and you begin to walk into it. You just keep going more and more and more into the center of it, almost as if you're walking into a cathedral-like cave. And that's all that this technique consists of. You just keep moving towards it and entering into more and more towards its very center in its heart. And that's another technique you might want to play with. Okay, so let's call the first one the artist's stool and the second one the eye of the storm. And maybe you could play with these. And note my word, play, right? Don't set up something weighing on it as an outcome. All right, get off your case, get off your back as an attitude. Rebecca, identify with it. No, not during those exercises, Rebecca. In fact, it's in some ways, the artist's stool is a stepping back to turn the experience into an object that you can observe and is distinct from your consciousness. I have to go, battery nearly dead. I know the feeling, right? Yes, you are disconnecting from it. The second one, the eye of the storm or walking into the cave, I've not yet figured out my own language for that. So I'm still working on that one. Okay, people. So, last week comment, making a diversion from the pain. Yeah, good. You know, I mean, it's good for you in general to have a laugh and dance and do other things. Yes, yes. But don't set it up as a piece of warfare to get rid of the pain. That's all I would recommend. Okay? Because see, when you do, just resist it as opposed to accept it and study it. When you resist it, well, you know what happens? Right now, I want you to use your willpower, your intelligence, and your imagination, all of your resources, please. And I do not want you to see an elephant in the room behind you. Now stop it, right? Now, come on now. Just use your willpower, okay? And by the way, do not make it into a blue toy elephant under any circumstances. Can you see it? Of course you can. You can't stop it appearing. Interesting phenomenon. I'm not sure anyone has quite explained that phenomenon yet. But do you see what I mean? Don't think I'll just diverse and I'll do this and I'll do that and that'll get rid of you. You'll just create warfare with it. It's quite the opposite of the acceptance. Okay. I'm going to start wrapping up now. And the reason I wanted to give you this grounding first talk was that we've focused on pain in this talk. Okay, and I hope I've laid down foundational ideas. And then what we're going to do in the next parts of our work together will not be labelled pain. All right, it'll be about re-emerging, it'll be about you, it'll be about bringing to life these insights and awarenesses that we've discussed as you begin on a journey of recovery and restoration and back into flourishing. So I wanted to honour the start point of pain and lay that down today in part one, so that in one measure we can start moving beyond it subsequently, starting next week. That sound all right? And all of these ideas require repetition. And don't hesitate to rewatch this talk because we've done this recording together. Emma's asking me, where's the book? I appreciate it, Emma. I think I've got the first draft that I should have for sale online in a wee while. Yeah, good stuff. Now, people, let's wrap up. And if you'd be good enough, you could start to just leave some feedback or closing comments with it. It's been lovely being with you and working with you. Thank you so much, everyone, for coming. Okay, what I'll do now is I'll stop the recording, but I'll leave the meeting space open for a wee while to allow for feedback to be given. Okay, good.